President Obama's health care reform bill is flawed and will likely increase taxes and not reduce soaring health care costs. It's all over the media that health care is broken. Undoubtedly, change is in order. Our politicians are working hard to reform the health care system. Mandated insurance coverage, rights to adequate health care, tort reform, and budgetary impacts are all very concerning. Now we're in the midst of the bickering between Republicans and Democrats. The problem is that President Obama's health care reform bill is flawed and will likely increase taxes and not reduce soaring health care costs. Government mandating insurance and removing the ability for insurance companies to consider pre-existing conditions is a dangerous combination. On the surface, this sounds like it might be a good idea. However, according to M. Levitt, A. Hubbard, and K. Hennessy, this might incent people to wait until they're sick to purchase health care insurance. It is arguable that there would be a penalty for not having insurance, but maybe after you weigh the cost, you might figure that you'll just pay the penalty and it'll end up costing you less in the long run. The penalty in this new law is roughly 20% of the cost, according to E. Klein in 2011. This mandate idea might offer some value, but just needs to be thought out some more if it will be part of any health care plan. Many will argue that it is a right to have access to good health care. This argument has its merits. If someone is in need of health care, they should be able to get it. In fact, Article 25 of the United Nations Universal Declaration of Human Rights says, "Everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and medical care." That's from the United Nations in 1948. Right now, without any type of health care reform, citizens cannot afford insurance. That cannot afford insurance can walk into a not-for-profit community hospital or free clinic and get care. In order to maintain not-for-profit tax exemption status, hospitals are required to provide a certain amount of charity care at a reduced cost to the community, according to S. Rosenbaum and R. Margulies in 2010. Out of a total of 5,008 registered community hospitals in the United States, 2,918 are not-for-profit. 1,092 are run by the state or local government, and only 998 are investor-owned for-profit hospitals, and that's according to the American Hospital Association in 2010. In addition to this, there are approximately 1,050 free clinics across America where healthcare providers volunteer to provide free care to citizens, and that's according to J. Darnell in 2006. Federal programs exist such as Medicaid and Medicare, which also cover medical expenses. So arguing that healthcare is not provided or available to all Americans is not valid. It is only used to sensationalize the issue. Given the aforementioned facts regarding the array of options available to citizens, this right to health care is already provided for today. Absurdly high damage rewards for malpractice cases cause a number of things to occur. The obvious effect is a high malpractice insurance rate, which hospitals and doctors are required by law to pay. Senator Bob Rucho, chief sponsor of the Senate tort reform bill, said, "Too many doctors have to pay for expensive malpractice insurance and end up running too many tests of patients to protect themselves from litigation. Both trends lead to higher healthcare costs and insurance premium costs for businesses and could be pushing some physicians out of business altogether." And that was in the Associated Press in 2011. Controls need to be put into place to prevent opportunistic lawyers from getting rich by sensationalizing issues and initiating frivolous lawsuits. However, in a 60 Minutes interview on Sunday, September 13, 2019, President Obama stated that he is not willing to put a cap on lawsuits against hospitals and doctors, and that was on CBS News in September of 2009. So now the cost. Who is paying for this reform and how? As you can see in this bar graph, national healthcare expenditures are projected to increase from $2.6 trillion in 2010 to $4.7 trillion in 2019. This is the baseline cost for estimates for national health reform proposals. according to the U.S. Department of Health and Human Services in 2009. President Obama's plan is claimed to be budget neutral, and that was on BarackObama.com in 2009. U.S. healthcare spending reached $2.2 trillion in 2007. This compares to $714 billion in 1990, according to the Kaiser Family Foundation in 2009. It is projected that U.S. healthcare spending will increase at an average of 6.2% per year, according to the U.S. Department of Health and Human Services in 2007. This graph is in trillions of dollars and illustrates the dramatic climb from 2010 to 2019. National health expenditures nearly double. From 2010 to 2019 is $35.3 trillion. And originally, according to the sales pitch that was originally used, healthcare changes would be budget neutral. That almost sounds free, doesn't it? This could be why the spin has been subtly modified to deficit neutral, meaning we're still going to spend money as long as we don't increase the deficit. This is very clever wordsmithing. Tucked away at the bottom of President Obama's fiscal 2010 budget is wording that describes limiting the tax rate at which itemized deductions can be taken to 28%. This will raise $318 billion over 10 years, and that's according to the Office of Management and Budget in 2009. So the need for change is obvious. However, the question is, what type of change is best for America? We should not change simply for the sake of changing. It needs to be a well thought out and planned. We need to put more thought into ideas like mandated health insurance coverage, rights to adequate health care, tort reform, while also considering budgetary implications for today as well as future generations. We need to incent and support healthcare systems to insurers to adopt operating models that are cost efficient without taking away from quality. Removing the privatized commercial aspect from the equation will only send us down the road of an overburdened, inefficient government-run health system. Are there any questions?
Yeah. How was the national health expenditure created for 2019?
An expenditure estimate for 2019 was created by applying the same growth rate to the 2018 level as was projected to occur between 2017 and 2018. This extrapolation provides a reasonable and appropriate estimate of the national healthcare expenditure for 2019. Although it's not as refined as the estimates for prior years, and that's according to the U.S. Department of Health and Human Services in 2009. Any other questions?
How would tort reform impact healthcare costs?
Representative Phil Gingrey stated in a letter to President Obama that the simple reality is that fear of ambitious lawyers and protracted legal proceedings are directly leading to the ordering of unnecessary tests which help safeguard against frivolous lawsuits, but also raise the cost of health care, and that was on CBS News in 2009.
One last question. What is driving healthcare costs?
New technology and prescription drugs are cited as major contributors to healthcare costs. However, chronic disease, an aging population, and administrative costs are other significant contributors to healthcare costs, and that was per the Kaiser Family Foundation in 2009.